Vitamin B12 deficiency symptoms that should never be ignored. Vitamin B12 is essential for several key bodily functions, including forming red blood cells, maintaining neurological health, and DNA synthesis. Because the body cannot produce B12 on its own, it must be obtained through diet or supplements. This video will discuss what are the causes of vitamin B12 deficiency, what are the sources of vitamin B12, what is the recommended daily intake of vitamin B12 for humans, what happens when consuming an excess of vitamin B12. According to research, up to 20 of people over the age of 60 in the United States and the United Kingdom experience vitamin B12 deficiency. Ignoring the signs of a B12 deficiency can lead to serious health problems over time. Today we'll discuss the main symptoms of vitamin B12 deficiency. Before we begin, don't forget to hit that like button and subscribe to our channel for more health tips and updates. Here are 8 critical signs of vitamin B12 deficiency that should not be ignored. Number 1. Unexplained tiredness. If you don't have enough vitamin B12, you might feel a different kind of tiredness. Even with 7 hours of sleep each night, you could still feel very tired and should check your B12 levels. This shortage can also affect how well you can focus and think. Without sufficient B12, your body's cells can't work right, which means your red blood cells won't form properly and won't carry enough oxygen. When your tissues don't get enough oxygen, it can make you feel weak, tired, and confused. Research shows that taking B12 supplements can help boost energy for people with a deficiency. If getting out of bed is hard in the morning, you might need more of these important vitamins. Not having enough B12 or folate can also cause megaloblastic anemia. This condition makes your bone marrow create too large and immature red blood cells, which can affect how your DNA forms. This type of anemia linked to B12 deficiency can also cause serious problems with walking, seeing, or remembering things. So it's important to make sure you're getting the essential vitamins your body needs. Number 2. Memory loss. As we get older, our bodies struggle more to absorb vitamin B12. Research shows that prolonged B12 deficiency can cause memory problems, confusion, and even dementia in older adults. However, there's no clear proof that taking B12 supplements helps those already experiencing memory loss. That's why it's crucial to keep your B12 levels up to prevent deficiency. Vitamin B12 deficiency is more common than other B vitamin deficiencies. Factors like poor absorption, not getting enough nutrients, digestion issues, and certain immune disorders can all contribute to it. Number 3. Pale skin. When you don't get enough vitamin B12, it can make your skin look pale or a bit yellow. Sometimes, people might not realize this is happening because they might think it's just something else. So they might not realize it's a sign that their body needs more of this important vitamin. Number 4. Depression. Vitamin B12 is really important because it helps our brain make chemicals that control our mood, like serotonin and dopamine. When you don't have enough B12, these chemicals can't work properly, which might make you feel down, irritable, or even make it hard to think clearly. Making sure you get enough B12 through supplements or changing what you eat is crucial, not just for staying healthy, but also for keeping your mind feeling good and avoiding feeling sad or grumpy. Number 5. Pins and needles in the hands and feet. Vitamin B12 is crucial for our nervous system because it helps make a protective coating called myelin around nerves. This coating helps messages travel smoothly throughout our body. Without enough B12, nerves can't work properly, causing problems like tingling in the hands and feet, which older people might notice due to nerve damage. Number 6. Blurred vision. A lack of vitamin B12 can affect your optic nerves, causing blurred vision. You might think you need glasses, but what you need is enough vitamin B12. So before getting new glasses, check both your vision and B12 levels. Remember to eat your vitamins. Number 7. Irregular heartbeat. Low levels of vitamin B12 can cause a fast heart rate, known as tachycardia. This happens because B12 deficiency can lead to a type of anemia that makes you feel dizzy, tired, and lose your appetite. It can also make your heart beat irregularly, causing sensations like pounding or fluttering, which can be scary and feel like a panic attack. Over time, this can damage your heart muscles or even enlarge your heart. To take care of your heart, make sure you're getting enough vitamin B12. Number 8. Movement problems. You know how we talked about not getting enough vitamin B12? Well, it's super important because if you don't have enough, it can mess up your nerves. And that means walking, running, or even just moving can become hard. Your feet and legs might feel tingly, weak, or even numb. It's like they can't hold you up properly. Plus, your reflexes might not work as well. But don't worry, you can fix it by eating foods like meat, fish, milk, and cheese, or you can take a multivitamin to make sure you're getting enough. What are the causes of vitamin B12 deficiency? Vitamin B12 deficiency can arise from several factors, predominantly linked to inadequate dietary intake or absorption issues. Vegetarians and vegans who omit animal products may lack dietary sources rich in B12, such as meat, fish, dairy, and eggs. Aging can lead to reduced stomach acid production, impairing B12 absorption from food. Conditions like pernicious anemia, where the body cannot absorb B12 due to a lack of intrinsic factors, and gastrointestinal disorders like Crohn's disease or celiac disease, which affect nutrient absorption, can also contribute to deficiency. Additionally, certain medications, such as proton pump inhibitors used for acid reflux, can hinder B12 absorption over time. What are the sources of vitamin B12? A well-balanced diet should include sources of B12, such as meat, fish, dairy products, and eggs. For those following a vegetarian or vegan diet, considering B12 supplements is important. These supplements come in various forms, including oral tablets, sublingual tablets, and injections. It's advisable to consult a healthcare professional to determine the appropriate dosage and form of supplementation. What is the recommended daily intake of vitamin B12 for humans? The typical daily recommendation for vitamin B12 in adults is around 2.4 micrograms. However, individuals with conditions like pernicious anemia or gastrointestinal disorders may need higher doses or supplements. B12 can be found in foods such as meat, fish, dairy products, and fortified foods. What happens when consuming an excess of vitamin B12? Excessive intake of vitamin B12 is generally safe due to the body's ability to excrete excess amounts. However, very high doses of supplements can cause side effects such as nausea, diarrhea, or skin reactions. In rare instances, it might interact with medications or contribute to conditions like hypervitaminosis. People with certain health conditions, such as kidney issues, should exercise caution. Consulting a healthcare provider before taking high-dose supplements is crucial to determine suitability based on individual health needs, as B12 toxicity from dietary sources is exceedingly rare. So regularly monitoring B12 levels, maintaining a balanced diet, and considering supplementation when necessary can help prevent and manage deficiency effectively. If you found this information helpful, please like, share, and subscribe for more insights into healthy eating and lifestyle tips.